Healthcare groups here are racing to have their staff receive the latest COVID-19 bivalent vaccination as they try to maintain manpower levels to meet persistently high patient loads. Plans include rostering them in batches to even vaccinating them on site, as Sherlyn Sia finds out.
Across its 30 clinics, Fullerton has been seeing up to 15% more patients coming in, fueled by the current XBB wave. It's now carefully rostering its 700-strong pool of employees, half of which are frontline workers, to get their boosters without affecting operations.
We are also working very closely with the clinics so that we can coordinate and ensure that the clinic staff can come at convenient time when they are off duty to get their vaccination as well. We are looking at to achieve 100% by the next 2 to 4 weeks.
The group is also ramping up manpower by 10 to 20% to help with any contingencies, such as if staff need to take sick leave. One Care Medical, which has some 200 staff across 30 clinics, is spacing out vaccination for them, especially for smaller clinics with fewer staff, at least 3 days apart.
If the staffing in the clinic is still quite adequate, I would say at least 2 to go at the same time. But if the clinic staffing is not still at a level where we might need additional cover should someone fall sick, we will advise that there should be just one person going at any one time.
That's as the clinics are continuing to see a 20 to 30% higher load of patients than usual. Public healthcare cluster SingHealth says it's aiming to preserve manpower capacity for patient care. The group will not offer the bivalent vaccine in its institutions, and staff can get their shots at vaccination centres. It's strongly encouraging eligible staff to get boosted to improve protection against exposure to COVID-19. Meanwhile, Thomson Medical is taking a different approach. It's working with the Health Ministry to acquire the bivalent vaccines to administer them on site. Vaccinations will be arranged in batches so that clinical operations are not impacted.